In the following case scenario, I believe that the standard of care and negligence was broken. The reason being is that on page 97, in the role of the physical therapist and assistant, it is the patient's right to be treated with safe and appropriate care. And based on the findings of the article, which stated that the physical therapist proceeded with the session without prior assessment from the physical therapist, that is number one, negligence being performed. Also on page 97, in the role of the physical therapist assistant, it states that the patient should have a right to a second opinion, which that wasn't given to her based on the physical therapist assistant moving forward with care without the physical therapist's evaluation. Secondly, the physical therapist assistant did not know any specific deficits in the mobility or strength of the patient, which it seems like she didn't even have a baseline to begin with to know if the patient had any deficits in the first place. At the beginning of care, the evaluating PT should have obtained informed consent from the patient, which would or which should have explained the findings and the examination, evaluation, and identification of the physical therapy diagnosis. Again, the physical therapist assistant proceeded with care without any of this. Now, when Miss Rodriguez realized that there was no prior PT evaluation completed, she should not have moved forward with the evaluation. She should have then contacted the physical therapist and rescheduled this session. Now, the laws that were impacted during this session as well are risk management, and according to Clinch Chapter 10, it states that an incident report should be completed by a person observing or discovering event. And since in the session the patient fell and the physical therapist assistant did not document any of these findings, this shows that she was negligent. I believe that there really was no reason to continue treatment, but Miss Rodriguez maybe felt that she could just do minor things such as improve range of motion that wouldn't be super harmful to the patient. But I think that that was a bad decision due to the fact that she had no prior knowledge of the patient having any neurological deficits. If I was a physical therapist assistant in this scenario, I would have immediately contacted the physical therapist and let them know that there was no evaluation done and to reschedule the patient when the evaluation was completed.